Nebraska Dental Association is having their 5th annual Mission of Mercy dental project, and what that means is dentists from all across the state come together along with volunteers and provide free dental care for 2 days to basically anyone in need who wants to come to the clinic.
Well, it's an amazing experience to observe hundreds and hundreds of people that are getting service from volunteers. The unfortunate thing is the real question as to whether dental care is a right or privilege, just like health care.
We had a family that came from about 2 hours south in southeast Nebraska, and this was a family of 4, and mom and dad both worked, and they did have medical insurance for their children but no dental insurance. And basically their income level would have fallen right just above where the cutoff is for the Children's Health Insurance Program. And so when she heard about it on the news at 6:30 a.m. in the morning, she left her job at work, went home, got her kids out of bed, and drove 2 hours to ensure that they would get the dental care that they so desperately needed. First of all, we have to have good public health infrastructure in place. Make sure that there's funding available for things like community health centers, making sure that there's money there for workforce issues, for dental students to be trained. We need to make sure that there are federal programs for loan repayment for dentists who are willing to go to rural and or underserved areas. And we also need to make sure that we have a Medicaid program that truly serves those in need. Finally, I think just with healthcare reform in general, making sure that everyone has affordable access to healthcare, whether that's through a private plan, a public plan, or some sort of combination between the two.
We need healthcare reform now. I mean, America's been looking at healthcare reform since the 1930s, and every 10, 15 years it's been seriously discussed, but we're now at the point where we cannot continue to move forward with escalating healthcare costs, decreasing quality of care, and more uninsured.
These issues have been studied for years, and there is ample scientific data that shows us where the problem is, how we solve the problem, and what type of resources that it's going to take. What we need for our leaders in government to come together and bring forth the experts and the stakeholders and start passing some policies so we can get the care to the people who truly need it.